today's function in itself is representative of Guru Shishya Parampara, which is coming right from the time of LD Dhawale to ML Dhawale and to now Kumar Dhawale and all of you. So we are all part of a Guru Shishya Parampara. Would like to talk about my experience with this? Sure. When I joined ICR, it was rather second year of ICR, I suppose so, 77, 78. And I was teacher in school, our medical college. There was a vast difference between what I was learning here in ICR and then what I have to teach in college. Because in college you have to follow certain discipline in terms of syllabus, in terms of curriculum, and you cannot ask question to the students in examination, out of syllabus, all those things were there. That was one experience. Simultaneously on other side, when I was going to ICR training, we had a hot discussion, and initially, of course, I was afraid of ML Dhawale looking at him, because his strict look and disciplined way of dealing with the students, because he was a principal when I was student in my homeopathic college, from 68 to 71. He was principal there also. And there this book of principle and practice was given to me, and Dr. Kasad inspired me to join ICR and go ahead with a further teaching in college so that I can improve my teaching. With Dr. Dhawale, I can analyze as a human being. He was absolutely hypersensitive about every relationship that he used to have with anybody, not only patient, with students also. Although appearing very strict and very something different by look, but internally he was like coconut. अंदर से अच्छा था, बाहर एकदम हार्ड था, तो शुरुआत में तो डरते थे, then gradually we developed a good relationship. Many a times it used to be very late in the clinic, in his clinic. He used to put me in my house in taxi when he used to go to Chembur. What I am talking is sensitivity and his way of dealing with the students. But as far as teaching is concerned, as a guru, he was very strict. Strict in the sense that he had something that a student should follow discipline. And I was the person who was most indisciplined in all my group. Never to come in time, come late, and then Dr. Dhawale used to close the door when anybody is late, so we have to be out till that session is over. Particularly in summer school, it was something like that, lot of discussions and things were going on. But as a teacher, I'll tell you, he was taskmaster true. But at the same time, Dr. Kasad drew my attention. Kishore, he is like that, but I told him, sir, if he is teaching like this to everybody cannot accept whatever he is teaching or may not understand also. Because his language, first of all, is English language. Oh, we are coming from vernacular Gujju, that to Baniya's house, and then coming in and his English, anyway. But then he told me that he is sensitive, he knows kisko kaisa sikhane ka, is very distinct. He was the first person in our college when he came as a principal. Now that NIT, NEET and all these things are going on. But when I joined college as a student, he was a principal. He took our test first. Before giving admission in homeopathic medical college, mind well. At that time there was no ICR, nothing. And he took our exam. And then we appeared, and there are 50 seats for admission. And he admitted only 27. And 27 mein luckily my 27th tha in admission. So this was his way of dealing. And he was really very sensitive. And when in clinic I used to observe him. His talk with patient was so free. ये इधर फ्री रहता है, हमारे साथ क्यों इतना स्ट्रिक्ट बनता है? इधर तो अच्छे से आराम से बात करता है. Then gradually he taught us many things. Dr. Tiwari was with me. We were together at that same time. And Tiwari also helped us very much because Tiwari was like a buffer. क्योंकि वो सर गुस्सा करते हैं और हमको अंदर से गुस्सा आता है, तो ही वॉज बफर, किशोर भाई ज़्यादा सोचने का नहीं, वो तो बोलेगा ठीक है. बट as you rightly said, Dr. Tiwari was really in between who could develop. His first seminar that was there in near Bombay Hospital or Liberty Cinema के बाजू में था कहीं, first that was related with what subject you told now. And that time, mind well, Dr. Tiwari, our English was very bad, our clinical knowledge was zero. I'll tell you one thing. When I used to appear in examination for final year in DHMS, our teachers who were there in Nanavati Hospital, what was their attitude, you know? एग्ज़ाम में कमिंग, सर्जरी का एग्ज़ाम है, ये क्या है सर? इट इज़ अल्सर. ओके. ये क्या है? ये ग्लैंड है. ये क्या है? ये सर अपेंडिक्स है. ओके, पास. इनफ फॉर यू. दैट वाज द एटीट्यूड, you know. With that state of our clinical knowledge, our English, we entered with Dr. Dhawale. Try to understand, डॉक्टर ढोले को कितनी मेहनत पड़ी होगी, वो हम आज सोचता हूँ. आई वॉज टेलिंग डॉक्टर कुमार सर, हेड्स ऑफ टू दैट मैन. हमारे जैसे डफर्स को भी इतना तो ऊपर लाया वो हम हमारी कैपेसिटी से इतना ही ऊपर आए. लेकिन यहाँ मेरे आगे पीछे यहाँ बैठे हैं सब लोग जिसकी क्लिनिकल नॉलेज इज मच मच मोर बेटर देन मी व्हाट आई यूज्ड टू हैव व्हेन आई वाज स्टूडेंट. एंड ऑर्गन, एंड आई टेल यू, I used to teach organon and philosophy. My main book was Principle and Practice. From there I used to teach, because that book I loved like anything, you know. And I used to teach from there. And organon में क्या पढ़ा हूँ वो तो मालूम ही नहीं पड़ा, क्योंकि organon itself was English again, you know. So इसे अच्छा है, Principle of Practice, Philosophy सिखा दो, symptomatology ये वो. Anyway, then Dr. Dhawale used to be, when we used to have discussion and all those things, Dr. Dhawale used to sit so coolly and calmly. We were all fighting and this, and Dr. Tiwari, as you know, master in running a session, particularly life and living. Usko life and living mil gaya to he is in full form. And Dr. Dhawale is also sitting behind, absolutely behind, in that we were there at Pratna Samaj. वहाँ एकदम पीछे बैठते थे Dr. Dhawale. And he used to make, I think Kanitkar was also there. Is she there here? She has not come. Kanitkar means now Belsar hai, sorry. Yeah. She was also, Dr. Dhawale, he found that we did not know English much. He appointed one English teacher to teach us English. Mind well how much sensitive he was. कि ये इन लोगों को एक English teacher रख दो तो थोड़ा तो कुछ समझेंगे. लेकिन it so happened that English teacher started speaking Gujarati. That was our state, you know. You can understand. So, talking of Dr. Dhawale's experience, my personal experience, many of us, you know, have many problems in our life, you know. And I found Dr. Dhawale was the best person to discuss with him about all these things. And he gave me one important lesson. Kishore, if you want to be successful in life, try to take responsibility. You are running away from the responsibility. Not only in your social life, but also in institution also. You are not taking it. And he offered me to be an associate director with Dr. Tiwari. Somehow there were circumstances I could not go ahead with it. But he was really a great man who could understand every aspect of student. And as far as his teaching, when I see all these Dr. कापसे का अभी बुक पढ़ा मैंने, ऑपरेशनल, that was first written in first summer school by sir, and it was small booklet with yellow color cover, you know. And Dr. LD Dhawale's mashal was there, you know. So that particular book of operational this thing, he asked us to read and asked us to put it in practice. We were really, to be very frank, we were tired at the end of the day. But no doubt, it made me a good teacher. I learned to make structures, and I made structures of all the materia medica drugs which many students have received by now, you know, and that helped me to be a good teacher. Even I was very angry on the students who were not answering me well in exam or so. After being in ICR for at least 3 years, I was there. Not a regular, but because at that time I was teacher, so I had to go part-time only. And I used to teach my students those. First, going in the classroom, I used to make big structure of the drug, and then. But I'll tell you, I learned from him how to analyze, how to evaluate, how to conceptualize. I think he has made my life smooth as far as homeopathic practice is concerned, and my understanding is concerned. At present, with whatever I have learned from him, today it has helped me tremendously, to the extent that whenever I'm going out of Bombay with various institutions and out of India also, they have accepted this manner of practice, you know. But even every Thursday, Dr. Dhawale used to keep lectures on, meeting on Thursdays. In my clinic also, since then I left ICR, every Thursday we have clinical meeting since that time. And that is his inspiration, you know, every Saturday. And I'll tell you today, whatever I am here, all obligations to whole Dhawale family. It's Dr. Dhawale, yes. LD Dhawale I could not see, unfortunately. And Kumar Dhawale, I think great parampara. It is a Kautumbik parampara. अपनी तो है ही, ये कुटुंबिक परंपरा भी है. बहुत बड़ी बात है ये. 3 generation तक education को, and what was teaching, who is a teacher and what is education, I did not know anything about it. After joining ICR, realize कि इसको education बोलते हैं, इसको teaching बोलते हैं, students को कैसे करना, क्या करना. Well, gradually I did try to follow all these steps that you had given for certain years, for some. Then लगता है ये ऐसा कर सकते हैं हम लोग.